I ruptured my quadricep muscle, dislocated both my hips, a lower back injury, nerve damage to my leg and my back. So a little bit of everything. I had to teach myself how to walk again. And it took me a little over 10 years, almost 10 years to get my full benefits.
Retired Army Corporal MARLO has navigated the VA system and its complicated bureaucracy alone for more than a decade, trying to get her medical needs met.
My health has been failing. I've had 10 spinal taps in the last 3 years for persistent brain swelling.
Hohn served more than 13 years in the Balkans and at the Pentagon, where a car ran her over in a training exercise. Since retiring, the Leander mother of 3 has come to expect a wait for appointments. But in recent years, she said simple referrals to see specialists have taken months, if they've been approved at all.
I've had to go out on the economy, which is what we call a doctor that we have to pay out of our own pockets, to get health care. I've been asking for over a year to go see an ENT because I have lymph node problems.
They served our country. They deserve nothing but the best from us.
Victor POLANCO with the Texas Veterans Commission is heading up an initiative from Governor Rick Perry to create a healthcare strike force team to advocate for vets like Hohn. Exact figures for the cost of the program are not available as Perry has not yet allocated funding for it. The team will allow military servicemen and women who experience roadblocks at the VA to call the Texas Veterans Hotline to relay their problems. The cases will be assigned to one of 14 specially trained counselors stationed at VA hospitals around the state who will act as a liaison between the federal system and the veterans who need care.
But we already know what needs to be done, and we'll just be able to say, this is what needs to be done. Let's see what we can get it done fast.
POLANCO knows the success of the strike force team hinges on the VA's willingness to work with them, and says so far, VA regional and individual clinic directors have expressed support for the initiative. Hohn says she knows such a program can't hurt.
To actually know that the government is there, someone, whether it's state, local, city, to know that someone's going to stand there between us and the federal government that's holding a lot of these benefits back, it's nice to know.
As soon as the governor's office approves a funding plan for the team, the Veterans Commission says it will be up and running within 2 weeks. Reporting in Austin, this is ALANA with the Texas Tribune.